Hi guys, good morning. It's Dr. Denny over at Four Paws at Fulshire Veterinary Clinic, and Ashley's going to be helping me today discussing everything you need to know about dog surgery. So she's going to go ahead and get us started off with some questions.
Dr. Denny, what do I need to know before my dog has surgery?
So first we need to know, what procedure are we having? We need to know what day it's happening. Your veterinarian should go over with you, no food after 9 o'clock the night before, water's fine, and then no breakfast the morning of, depending on which veterinary clinic that you go to. But those are going to be kind of your highlights. Most veterinarians will also give you an update. Hey, when your pet's awake, at least we do. You get text messages when they get their pre-meds, when they're moving into surgery, when they're in recovery, and when they're awake, and then when they're ready to go home. So we do a lot of communication there.
Will my dog need lab work prior to having surgery?
So we strongly recommend lab work for every single patient. It is required at our practice for any patient that's over 4 years of age. That makes it optional for any patient that's under 4 years of age. But I do strongly recommend it because you'd be surprised at those screening tests where we might find something that might change how your dog processes anesthesia. And there's always a risk with anesthesia. Our job is to mitigate that risk and make sure it's as low as possible. By having those preoperative lab work, it is a little bit of an additional cost, but if there are liver, kidney changes, white blood cell changes, red blood cell, platelet changes, that might change if we postpone the surgery, what drugs we use, and what sort of maybe post-op complications would we be watching out for. I believe preoperative labs is really important.
Does my dog need to see a specialist for their surgery?
So it depends on which one it is. So here at Four Paws, we do not do orthopedic surgery unless it's like a toe amputation or a tail amputation. Orthopedics is just not something that I do. So we do refer those out. So for anything like repairing a fracture, or if we've got a knee injury that needs to be repaired, or if a foot has to be rebuilt, that's something that we are going to refer out. Other types of major surgeries that we would refer out are like anything like in the chest, so heart or lung surgery, we're going to be referring out. Anything to have to do with the gallbladder, would be referring out as well. For the most part, we handle a lot of soft tissue surgery here. I'm fairly comfortable with a lot of different procedures. But that's something we would talk about at the time of when we're coming up with a plan on if your dog needs surgery or not. And we would talk about, okay, well, here are your options.
What will my veterinarian be looking for in the pre-surgery lab work?
So I'm looking to see if our liver and kidney values are functioning. I'm looking to see if our red blood cell counts are normal. I'm looking to make sure that our white blood cell counts are normal. I'm looking to make sure we have platelets because when we're doing surgery, we are cutting into tissue and your platelets help you clot, right? So if you don't have enough platelets, then you can't clot and you can have bleeding issues post-operatively. So those are the main things that we're looking for.
Who will be monitoring my dog while under anesthesia?
So I think that's a really great question. So it's kind of a team effort, to be quite honest. Every patient here at Four Paws in pre-op and intra-op has two technicians with them for the majority of the time. I'm also, because I perform all the surgeries here, I'm also like glancing up at the monitor, tracking things. But your pet or your dog is having vitals monitored every 5 minutes via machine, but everything's being double checked physically with a physical like stethoscope and a physical exam like every 5 minutes. So we have all the same monitoring here actually that you would have if you as a human were going under anesthesia as well.
How long will my dog need to recover after having surgery?
So it's going to depend on the procedure. Okay. Anesthesia that have to kind of work its way out of its system first. So that can take, the rest of the day, sometimes 24 hours, especially if the pet's older. As far as like an actual surgery with incisions. So incisions take 10 to 14 days to heal. And then it's going to be dependent on what surgery we had. So if we had a blockage and we had to cut into intestines, we're going to be sitting on kind of pins and needles for at least a week, making sure that everything heals okay. But again, that incision's not sealed for 10 to 14 days. So a good rule of thumb is 10 to 14 days.
And then last question, how can I help my dog recover at home after surgery?
So we want them calm, quiet. We need to make sure that they have access to food and water. We need to make sure that they're able to get up and go to the bathroom. We need to make sure that they're responsive to you, that their gums are nice and pink, that there's no discharge from the incision. Like, some bruising is to be expected, but we shouldn't see like tons of bloody discharge. That's not normal. So in those events, like, you do need to let us know. All right, guys, I hope this helped answer some questions you may have about dog surgery. If your dog is due or is coming in scheduled for surgery and you have further questions, please feel free to give us a call. Thanks.